Let's understand how cancer comes about. We shall start with the basics. Let's take an example of the fingernail. Every month, you will cut your nails. It shows that there is something that is producing new cells, which actually do grow and they die out, and you're able to cut off the dead cells. So, in an example of the fingernail, the division of these cells occurs in the nail matrix that is at the base of the nail. So at the nail matrix here, this is where the nail cells divide and give rise to daughter cells that will finally grow and you cut off your nails. So the same thing happens in every system. In your eyes, in your liver, in your stomach, in your kidneys, cells are dividing actively every time, even as we are talking. Cells are dividing to give rise to daughter cells, such that the old cells can be shed off and the new cells come in to take place. The activity of cell division is programmed, but usually mistakes occur, just like in any process. As cells divide, some mistakes can occur in the division of DNA, in that the new cells that are produced are different from the mother cells. Why should they be the same? Maybe that's the question. Let's go back to our nail. The cells of the nail, when they are dividing, they should produce exactly nail cells so that the nail can remain a nail. Meaning that the cells of the nail should not divide and give us maybe a cell of an eye or a cell of, let's say, an ear. Literally, it has to be a cell of the nail. That's what we call terminal differentiation. The daughter cells should look like the mother cells. In case there is a mistake in cell division, there are proteins that are within the nucleus that do control the cell cycle. One of them is called P53. If at all a daughter cell has a mistake in the DNA, it halts the cell division and it takes it in a process that we call DNA repair, whereby the DNA is repaired so that it looks like the mother cell. There are conditions that hinder this process of DNA repair, things like immune suppression and multiple other things like sun exposure, drugs. If at all there is any condition that is suppressing your immune system, our immune cells are meant to do what we call immune surveillance. Their purpose is they are soldiers, literally. They are white blood cells, the ones you hear about. They are meant to make sure that everything is in order. So if at all a daughter cell is produced and it doesn't look like the mother cell and it cannot be repaired by our P53, our immune system cells, our white blood cells come in. They're called T helper cell and cytotoxic T cells. They come in and they kill off that daughter cell that is abnormal, meaning that it will not go on a path of also producing abnormal cells to give us cancer. So in case the immune system is destabilized, our T cells will not do that function because they are not there. The body is not producing enough of them. When daughter cells are produced during cell division and they do have these mistakes, they'll go on to produce other cells with the same mistakes in the DNA because they are not being eliminated. And some of these mistakes could be uncontrolled cell division. So the DNA of daughter cells will be dividing without any control, without any check or balance. And when they divide out of proportion, or when they divide so much, they also create their own blood supply. And we end up getting a swelling because these cells are dividing so much, they are not being controlled at all. The body doesn't have the ability to control them. They have mistakes and they are dividing uncontrollably. And so we get a swelling, what we call a tumor. So a tumor can be benign or can be malignant or cancerous. How do we differentiate the two? A benign tumor will be a swelling that is, cells are dividing out of proportion, but they are similar to the mother cell, meaning that they are well differentiated. Like the differentiation is there, and they look like the mother cells. So meaning that they are of the same tissue. So it can be a benign tumor. It can occur on the skin. It can occur on the eye. It can occur in the bone. It can occur in the liver, wherever. But usually benign tumors are not worrisome. We usually operate them out. But if it is malignant or if it is cancerous, it means that these cells that are in this swelling do not look like the mother tissue. It may be a swelling on the skin, but when you cut it out, they look like nerve cells, or they look like brain cells, or maybe liver cells, because they are poorly differentiated. They look like anything. So these malignant cells have the ability to spread through blood and go in other areas. So that's what we call metastasis. So literally, when we take out a tissue from a swelling from someone, we have to take it to the laboratory to check it out. Is it benign or is it malignant? When we conclude that it's malignant, then we say this is a cancer. It can be anywhere. It can be in the prostate, it can be in the brain, it can be in any tissue, but the principle is usually the same.